The New Age Cannabis Podcast starts now. Welcome to the New Age Cannabis Podcast, where we talk about all things cannabis from an African perspective. Join us and our amazing, awesome guests as we talk about all things cannabis and all the possibilities and benefits of the plant. Today, we will be discussing using cannabis as a lifestyle to cope with cancer. Our guests today are the awesome Dr. Chuma and Nalika Dewlok. Welcome back, Dr. Chuma. Very good to have you on our show again. How have you been?
Good day, yo. It's good to be back here. I've been good, I must say, and I'm always excited to be here.
Fantastic. And today we will be talking a bit further past the pain management and moving on to specifically looking at cancer. And that's why we have our primary guest here today with us, Nalika Dewlok.
Thank you for having me. I'm looking forward to it.
Please tell us more about yourself and more about your journey with cancer.
Well, I am 37, and at the end of last year, I was diagnosed with stage 3 papillary thyroid carcinoma, which is cancer of the thyroid. And I needed to have an operation to remove my thyroid as well as the tumor that had grown in my neck, which I did, and subsequent to that had radiation treatment. And during the course, even prior to my diagnosis, I had been using cannabis, but before I started radiation, I went back on cannabis pills, which were made of coconut oil and cannabis extract and valeria, which is a herb which also deals with anxiety, but and for those purposes as well as being able to rest. It also assisted me with pain better than the Schedule 5 painkillers I'd been prescribed by my doctors. So, my interaction with cannabis as an aid to the process in terms of the treatment for cancer has been, something that I could not have gone through this without.
It added a lot of value to your
absolutely.
life. Okay.
Eased pain, particularly so post my operation. In fact, while I was still in hospital, don't tell my doctors this, I had the pills with me. And because the morphine that they were giving me wasn't easing the pain in my neck, because I had quite a significant cut, I wasn't able to find a good position to fall asleep in. And once I'd been discharged from ICU into the general ward, I actually took one of my pills, these cannabis pills, and it eased me off into sleep, and I had no issue in terms of being able to position myself to sleep. And I think I had, after 3 days post-surgery, I had my first sort of 8 to 10 hours of sleep because of that.
Wow, that's absolutely phenomenal. Yeah. And I think from what you said, it sounds like there's various ways to actually consume cannabis in order to achieve pain reduction. From your experience, which one was the most painless, I guess?
The easiest way to take it into as an aid to pain has been this CBD THC extract into pure coconut oil. That for me has been the most effective, and I take 1 ml in a capsule every night, and that's the only amount that I need, as opposed to the tramadol, for example, which is a Schedule 5 drug that was prescribed to me, which I needed to take several times a day in large quantities. And in spite of that, it had more bad side effects in terms of your ability to do anything, or how you feel wobbly or sleepy and things like that. Whereas this aided you in your restful night's sleep, and it managed your pain throughout the day without having to take more than 1 pill and 1 milliliter, quite literally, a day.
Fascinating story, very fascinating. But obviously there's a bit of a taboo attached to cannabis. So how did your family react, and how did you manage to actually convince them that this is a viable treatment for the ailment I'm currently experiencing with regards to cancer?
So my history with cannabis extends much further than just my cancer, which has been a recent development. I started using cannabis about 20 years ago, actually, and my family was aware of the fact that I did, because it wasn't seen to be too taboo, on the basis that in my family over the generations, cannabis was something that was used and grown in a lot of instances to be used as for medicinal purposes. I have an aunt who swears by it, and she's in her 70s.
So the use was not that difficult in terms
No.
of convincing the family.
Not at all. And I mean, the thing is that you need to go in with the approach as the individual making this decision that this is something that aids in your recovery. It is not the be all and end all of your recovery. So this is how I approach my use with marijuana, and particularly in this time with my cannabis, there were benefits to it, which I'd learned prior that I could apply. And for example, I had broken my ankle, which was the first time that I used these pills. And the reason why I switched from regular prescribed drugs to the cannabis pills was because of that single use per day. And also, when you're taking those Schedule 5 painkillers, you have no stability. And I was on crutches. So it was a lesson learned from there that was applied in my during my cancer treatments.
Very intriguing story, Nalika. Thank you very much. Doc, from everything you've heard from Nalika, all the anecdotal evidence that she's mentioned, what's the medical reason for her having achieved these benefits during her cancer treatment from using cannabis?
I would say first let's look at understanding what is cancer and where is cancer coming from. And with my training, my experience being both a clinician and an energy medicine healer, I'm going to be touching a bit on the energy system of the body. If you look at any form of disease truly is dis-ease in the balance of the energy systems of the body. And it has been proved that what brings about cancer, which is the abnormal division and propagation of cells in cellular structures, is a disruption in the energy systems of the body. And now, in particular, you're looking at a disruption in the endocannabinoid system of the body, which is the system that keeps the homeostasis of all the systems of the body. So cannabis would not only focus on just pain, it truly looks at stabilizing the entire endocannabinoid system, which therefore you would get the effect of pain, you would have increased sleep, you would also have inflammatory processes in your body reduced. If you're looking at managing all of these pharmaceutically, you are looking at a cocktail of drugs. You are looking at drugs for pain, you are looking at drugs for sleep, you are looking at drugs for nausea, you are looking at drugs for the anxiety that you would have because you are dealing with cancer. You are looking at drugs probably for depression. And if you just use one substance that would stabilize the endocannabinoid system, then you have touched the stability of all of those systems with just one substance.
I think I'll go and ask a question to both of you at the same time in terms of cost-wise. So you're talking about a cocktail of drugs, pharmaceutical drugs, which obviously can get very costly for the user. So Nalika, what have you found in terms of the cost variance between using drug cocktails, if you will, and using cannabis for the treatment, and from your perspective as well, Doc, in terms of how the costs change in terms of helping more people using cannabis-based products? I think I'll start with you, Nalika.
Well, first I want to respond to what Doc has said, which I agree with entirely. It does have a multifaceted impact on your system, along with assisting with anxieties and things like that, and pain and sleep. I found that when I spoke to my nuclear doctor who gave me my radiation pill because I took it orally, because taking cannabis increases your receptors, the radiation actually sat and pulled into the areas that it was required quite strongly. So to the extent where at my 7-day scan, she was quite surprised at the fact that it was so strong, and it presented like a star even on the scan, and said to me, I've never seen this happen because your radiation should have reached its half-life, which means that it should be deteriorating, and it looks like it's going nowhere. And I said to her at that point, well, the only thing that's different in me than in anybody else might be the levels of THC I have in my system. So, I feel like, and it's anecdotal, obviously I haven't had medical training, but those are things that have been said to me where I've said, well, there can only be one other thing that it is. So it is a multifaceted attack on everything that may go wrong. And I found it particularly with the thyroid being removed. The thyroid hormone helps you stay level in terms of your depression, and without it in your system, you actually fall quite considerably. Now, not having had it in my system for a few days, my doctors were surprised that I was upbeat. So the reason I tell you all of that before I answer your question on cost is because cost is financial, yes, but also there is the benefit and how I see the benefit. I see using marijuana as an aid in things like my anxiety, managing my anxiety, pain and things like that, as being a better way because it allows me to be functional, a functional human being, whereas these pharmaceutical drugs have a tendency to make you lethargic and slow, and even in the sense of your mind. Now, coming back to the cost of it, when we talk about the cost of marijuana, it depends on the way you take it in and how much it will cost. But the person who I get these extracted pills from charges 10 Rand a pill, and I take one a day. So that's literally 300 Rand a month, 310 Rand a month that you're spending on pain management, which is simple and effective. So from that perspective, if you're using this drug and you're able to get it at this cost, it makes sense financially as compared to the pharmaceutical drugs, which if you aren't fortunate enough to have medical aid, you'll be paying over 1,000 Rand for 100 pills or whatever it might be.
I think if we just turn back to Doc from the cost perspective, from what you said previously, essentially you then need drugs to counteract drugs. So you end up just taking more and more drugs because the one drug actually gives you anxiety, then you need pills to cover the anxiety, which then gives you sleep apnea or sleeplessness, and then you need sleeping pills, and then it becomes, like you said, a cocktail to function, which obviously increases in cost as well. So from the perspective that she's just mentioned, if you're looking at the cocktail, how much would the cocktail be versus what she's actually managing to achieve by using cannabis as her pain treatment?
As much as I'm going to be talking about the price of the cocktail itself, I'm going to first start talking about the price of achieving the health and wellness itself for a cancer patient, if I may say. As a public health practitioner, I am not only concerned about the cost of the drugs, which is substantial on its own. I'm looking at the cost of the entire process and the entire system of gaining back your wellness. She has just mentioned that the half-life of the radiation was slowed down. So you are looking at a possible reduction in the dose of the radiation that's going to be given to that patient. Reduction in the dose of radiation is going to give you a patient that has lesser radiation-related side effects. So you are going to be reducing also on the other drugs you would be needing to use on the patient to deal with the side effects. Looking at how quickly she can go back to work. If she's got less radiation side effects, she's going to be back on her 2 feet and she's going to be functional quicker. So she's going to be able to take care of her family, do her normal duties at home, and go to work even earlier. So it's not truly only drug-related cost, it's a health uptake cost that can be reduced. Going back to the drugs, pharmaceutical drugs are sadly quite expensive because of the process of drug development. Roughly, I would say she has a budget of about 310 Rand per month, and probably that's the budget of the cheapest antiemetic, which is the anti-nausea drug. You're looking at thousands of rands from the drug cocktail that she would be needing. So it's a huge reduction in the cost. Only looking at the drug cocktail process, it becomes even massive looking at the health system economic impact it will have into the process.
Absolutely.
Wow, that sounds like a huge cost cut, looking at thousands of rands to a 300 Rand a month. Would you recommend that people take on home remedies where it comes to treatment?
Look, yeah, as much as it superficially on face value looks like an exciting cost cutting and an exciting space where it would increase access to wellness for many people, I wouldn't recommend that people just do their own backyard growing and taking off any of their herbs, including marijuana products. You need to be knowing what you are doing. You need to have knowledge on the herbs themselves. You need to also have knowledge on what is happening with your body and your illness. And you need to keep always remembering that there are safety issues in the process. So you actually need to have a team that's working with you and that's got the knowledge around what is happening and what needs to happen. So I wouldn't recommend that you just jump off and just grow your own herbs and take your herbs in whatever form for whatever disease, including cancer.
So professional recommendations are 100% what you would suggest for anyone who's looking to treat themselves, especially with cancer.
And definitely that's true. And professional recommendation does not only mean physician. It could be someone who is truly knowledgeable in the drug, in the herb itself, and in the growing process and in the extraction processes. It's a teamwork.
I think with that said, Nalika, from your perspective, did you have a team that you were working with?
So I've been fortunate in the sense that the person who manufactures these pills has done a lot of background research, is very, very knowledgeable. But in addition to that, I've had pretty open-minded doctors. So what I've done is I've declared to them that this is what I take. They've asked for the type of strain and any additives that are used. And because it's not alcohol-based as well, I think they were pretty happy with that extraction process. So, from their perspectives, they didn't see that it would do any harm. Having said that, it's not used to replace anything other than the pain medication at this stage in terms of my treatment, because there are other drugs, for example, altroxin, which deals with thyroid hormones, because I don't have that production any longer. And unfortunately, for example, the parathyroids died because of the extent of the operation. So now I have to take calcium manually, whereas your body will produce and release what you need as you need it. So it's not to in any way replace any of the cancer treatments that I receive, but to enhance their ability to work, because like I mentioned earlier, the pills, the THC and CBD combination heightens your receptors. So all that does is it allows your body to absorb and take in any other treatment that you are having at a better or higher rate than would normally be the case, as we found with the half-life of the radiation.
Okay. So, Doc, what additional information would you recommend for people to go and check if they were looking to get treatment on pain and cancer and different sorts of ailments that you think would be aided by the use of cannabis?
I would say anyone who's considering going into adjunctive therapies or complementary therapies, the first point of call is to be open and honest with your treating physician to do say that you are interested in bringing in the complementary therapies, and you with your physician discuss the path. There's enough information out there. If you are looking at information regarding cannabis itself particularly, there's a journal of cannabis research. In the journal of cannabis research, there's scientific papers on the production of cannabis, on the use of cannabis for different medical ailments, and the latest findings on the use of cannabis and cannabinoids. But there's literature literally everywhere. Some literature truly talking the truth, and some literature very junky, and some literature quite biased. But there's also the Society for Cannabis Research. The Society for Cannabis Research also does have some literature. And some of the people who are product developers, they would have information on their websites. Some of them have information portals where you can actually join and subscribe and get ongoing latest information on cannabis and cannabinoids. And there's also the South African Cannabis Research Institute. They also put out literature out there.
Thank you very much, Doctor, for giving us that perspective on where to get the information that can assist people in finding out how to get more information on using cannabis as a complementary treatment for whatever ailments they have, including cancer. And you can find the links to the information sources in the description below. Stand a chance to win a hamper from Green Edge Beauty. All you have to do is subscribe, tag 2 friends, and comment why you love the show so much in the comment section. Good luck! And it's time for today's Canna Quiz with me, the so-called cannabis guru. Dr. C will be quizzing Nalika and I and seeing what responses we get. And this time around, I'm confident I'm gonna win. The way this works is, a question is asked, and whoever says their name first answers the question. You can also play at home, so feel free, join in, and let us know what the results are. Record yourself if you have to. Dr. C, we are ready.
Okay, guys, welcome to Canna Quiz 4. I'm going to be asking the questions. Are you ready?
Yeah.
Okay, question number 1. Which gender was generally excluded from the clinical?
Yao. Female.
Let's hear from you.
Female.
And why?
Because of their hormonal balance that was not perceived at that point in time to be in line with what cannabis does.
I'll take that. I'll accept that. Thank you. All right. Question number 2 coming. Which musician was laid to rest with a cannabis bud?
Yao.
Nalika, we'll take you.
I'm taking a shot in the dark, but is it Bob Marley?
Bob Marley, yes. That's good. That's perfect.
I was
That's
going to say
true.
Jimi Hendrix. Cool.
We move to question number 3. What are the origins of the name marijuana?
Yao.
Go for it.
It was made up by someone whose wife's name was Joanna, and he married her, so he loved her and he loved the bud, so he called it Mary Joanna.
Give me hope, Joanna.
See?
Hope, Joanna. Now
Is that
I
correct?
understand
That's not correct. That sounds like a very nice thinking pattern. But unfortunately, no, that's not correct. This is coming from a Mexican slang with a Spanish pronunciation. It's a Spanish pronunciation for Mary plus Jane. Mary Jane.
The simplest reason is like
Yeah. Mary Jane, Marijuana, Mary Jane.
Marijuana. So maybe the name of that lady who was loved so much was Mary Jane.
Maybe.
Okay, we go to question number 4. Are you ready? Question 4 goes, which rapper's ashes were mixed with marijuana and were smoked up? Which rapper's ashes were mixed with marijuana and were smoked up?
Yao.
Yes, yeah.
So right now I'm just thinking of all the dead rappers who liked cannabis, so I'll say Eazy-E.
Not this time, no. Think about another rapper.
Biggie Smalls.
No. Should we give it the last round? Whoever takes it first?
Tupac Shakur.
Tupac, you're right. You get that one.
It was either Biggie or Tupac. It's the same sort of.
Well, doesn't Eazy-E count? He was friends with Tupac.
Now we go to the last question. Question number 5. The biggest question. Which British monarch used cannabis? Which British monarch
Yao.
used cannabis?
Uh,
We'll take you, yeah?
Prince Andrew. Jeffrey Epstein, what else?
Pass. Let's hear from you, poor male folk.
Is it? Can I ask? Like, was it male or female?
That's not fair.
Now
But give her
you
that one.
want.
It's a male or female.
You wanting to be spoon-fed, now it's a female.
Ah. Huh.
Yao.
That's very interesting. Go for it.
Yes, yeah.
Princess Diana.
A poor princess.
I was thinking that, but then I meant maybe not. What, Catherine the Great? No, Catherine wasn't. She wasn't.
It's not too far from Princess Diana.
Camilla Parker Bowles. She's not a royal.
Go to the older ladies.
Queen Elizabeth.
Oh yes, Queen Elizabeth. But I'm not going to take Elizabeth because there's actually 2 Elizabeths. You didn't say which one.
Fair enough.
So we'll drop that one. We'll give it to the house. So, counting our scores. Well done, Nalika.
Thank you.
You win, yeah. Next time, my man.
I'm as surprised. I'm as surprised as you are.
Next time.
Thank you very much, Dr. C, for that. Much appreciated. Congratulations, Nalika.
Thank you.
I would shake your hand.
Gracious.
So, Dr. C, can you please help us and just bust some of the myths that there are around cannabis use, especially from the medical perspective? What myths have you heard that are just not true about cannabis use?
Okay, catch you one, I must say. But I think the biggest myth that exists right now is if you use cannabis, whatever form you use it in, it's causing schizophrenia and mental illness. That's not a true statement. It depends on how you use cannabis, what form of cannabis do you use, how often, and it's also affected by your own genetic makeup and your own psychiatric and psychological background.
Fantastic. Any other myths?
The other myth is the belief that cannabis oil is addictive. I don't think cannabis oil is addictive. It's just that the feel-good effect that the people get from the cannabis oil use is what they do not wish to let go of. So it's not chemically addictive at all. That's a myth.
Wow, fantastic. 2 very common myths, absolutely busted. So Nalika, in using cannabis as a complementary treatment, did you experience any drawbacks? Were there any negative side effects from using the cannabis?
Not per se, not negative effects, but at times, depending on the strain of marijuana that's used, there's some of them that cause you to feel somewhat anxious and things like that. But then during the course of using marijuana, whether it is as a pill that you take or whether it's smoking, you tend to weed out those strains that don't react well to you. So, for example, with myself, I tend, aside from the pill that I take once a day, I tend to consume sativa as opposed to indica because there are significant differences. So it's a matter of also working through what works for you and sticking to those things that are complementary and assist rather than just going out blanketly and using marijuana because that's what you've been told. So there needs to be a level of understanding. I have seen it impact other people in the sense that a friend of mine took one of the pills that I take and became very high. I don't feel that effect of it. It simply puts me to sleep. So again, it depends on the individual, as Doc was saying, their physiology and how it reacts to what you're putting into it.
Okay. Doc, from a medical perspective, what's the likelihood of drawbacks or negative side effects from using cannabis in various treatments as a complementary or adjunctive treatment? Is there any anecdotal evidence showing negative side effects?
In the time I've been involved with the use of cannabis as a complementary treatment, there has been very few side effects seen from patients. Remember also some of the information that we are working on right now, because this is very new in the clinical trial platform. It's clinical information we've been gathering from patients that have been users. It has been very rare to get side effects, even though with some people you get people who experience either side effects or people who just experience effects and feelings that are not truly nice to them or that are not truly tolerable by them. So in that regard, I would say it is very individualistic. Generally, it is having the least side effects compared to many of the pharmaceutical products that we use for both pain, for chemotherapy and for the radiation therapy, as well as many other serious disease treatments that we are using. But when you suffer bad effects from any chemical you've taken, the first thing you need to do is to withdraw the use of the substance. Go and see a medical practitioner or someone who's got health knowledge to help with you in case it's serious side effects. We don't want people suffering potentially deadly side effects alone. And also with time, you get to learn to know which products go well with you, which products you don't tolerate well. So it's all about that same old teamwork that I have talked about.
Dr. C, thank you for the insights. In closing, what would you like to tell the world?
In closing, I would say as much as cannabis use has been stigmatized for a long time, we have enough proof that there's a lot of advantage that we have not been getting because we were avoiding the use of cannabis as adjunctive therapy or as complementary to the main treatment modalities that we are using. We have enough evidence to prove that cannabis use is safe when used within a safe space. It is safe when used with the correct knowledge and the correct practitioners who have adequate knowledge around the cannabis and the use of cannabis. So anyone who's interested in trying cannabis therapies as an adjunctive therapy must speak to their treating physicians and explore how they could bring this into their treatment methods. And to my fellow doctors, I would like to say maybe it's time for us to stop being so stereotyped, if I may say, and be open to other avenues, including the avenues that we don't have immediate knowledge about. It's high time that we open up and we read up and we are embracive in the modes of therapies that we are using in helping our people. It's truly all about wellness and functionality. Thank you very much.
Wow, fantastic. Very, very powerful words. Nalika?
All I have to say in closing is that I am glad that I have the opportunity to use these marijuana products not only for my cancer but for other ailments and injuries that I've sustained previously. And I would recommend to people that they do go out if they have ailments like pain or if they're going through the process of treatment for cancer, investigate the use of marijuana to aid in the process, and also be open and honest with your doctors, your physicians, whether it's your nuclear or your endocrinologist, that you are using these products because it assists them in understanding what your physiology is and how you are to be treated as well. So it informs them quite nicely. But I don't regret having embarked on this journey, particularly with the cancer treatment.
Thank you so much, Nalika. Thanks. Guys, how can we get in touch with you on social media?
I'm on Facebook as BMS Wellness Dr. C.
Well, you can get me on my Twitter handle. It's Nalika_D.
Don't forget to subscribe to our channel for more information and updates on the New Age Cannabis Podcast. Lastly, don't forget to enter our competition and win a Green Edge Beauty Hamper. Good luck!